Good morning and welcome to the Healthy Food, Healthy Farms webinar series. Today's webinar is A Generation in Jeopardy, Ever Stronger Science on Pesticide Harm to Children's Health. It's the first of two webinars we've planned and will co-host with the Pesticide Action Network of North America, or PANA. Next slide. Co-sponsors for today's webinar include the University of California, San Francisco Program on Reproductive Health and the Environment, Physicians for Social Responsibility, Los Angeles, and the San Francisco Bay Area PSR chapter as well. I'm Dr. David Wallinga, your moderator, with Healthy Food Action and the Institute for Agriculture and Trade Policy. Healthy Food Action is a nationwide effort to engage health professionals around the food and agriculture policy issues critical to creating a healthier food system. Just a few logistical points for people attending. After the panelists' presentations today, we should have lots of time for questions. Please submit your questions anytime during the webinar. The earlier the better. Using the right-hand menu on your screen, look for the box labeled Enter Questions for Staff. Type your question and then hit send. We'll cover as many questions as possible in the 20 or 25 minutes that we have allowed. Today, I'm joined by Dr. Bruce Lanphear, a physician and professor of pediatrics, now at Simon Fraser University. For many years, Bruce was at Cincinnati Children's Hospital, and he's a leading expert on the impacts of environmental chemicals on children's health. We're also joined by Kristin Schafer. Kristin is a researcher with Pesticide Action Network and lead author of their new report from October, A Generation in Jeopardy, How Pesticides Are Harming Our Kids' Health and Intelligence. She'll tell you more about that report. As a physician myself, I've long been concerned about the hard data that children and pregnant women are exposed routinely to a complex mixture of pesticides and other chemicals, numbering in the hundreds in many cases. Among pesticides, we know that many are either known or suspected carcinogens, hormone disruptors, and toxins to the brain or nervous system, to name just a few health concerns. They were put on the agricultural market oftentimes without safety testing that was comprehensive for possible effects on developing children or developing brains and immune systems. They weren't tested either singly for these impacts necessarily, or especially in combination. And on the other hand, the science that there are impacts occurring has exploded in recent years. Clinical nurses, physicians, and other health professionals don't typically hear or read about this science, including in their training or practice. So I think it's especially timely today to hear from speakers who do read this literature and have thought about the implications. I'd like to hand things over now to Kristin Schafer, our first presenter.
Thanks very much, David, and thanks to all of you attending. We're very excited to be having this conversation with you all, as our overarching goal in producing this report has been to move the national conversation about children's health and pesticides forward. Let me ask first, are my slides showing up, David? Is that showing up on the screen?
Yes, they are.
Great, thank you. So first, a few words about kind of what brought this report about. In following these issues, we found that the research on pesticides in children's health often focuses on a single health outcome and a single chemical or a single route of exposure. So what we've tried to do in producing the report is to step back and get a sense of the bigger picture, since as we all know, children are not exposed to one chemical at a time, and in fact are dealing with a range of environmental contaminants in their daily lives. So our team of scientists at PAN reviewed more than 200 studies, focusing mostly on findings released within the past 5 years. We also reviewed CDC and other government data to get a handle on some of the current trends in children's health. So my presentation will basically have 4 sections. First, I'll present a brief overview of what the data tells us about trends in children's health outcomes. And then I'll turn to some, just a handful of highlights from the recent science we reviewed exploring how pesticide exposure is contributing to children's health problems. And then we'll look briefly at exposure pathways and children's unique vulnerability to pesticides, and then finally walk through our policy recommendations. I'll move fairly quickly through the presentation. As David said, we're hoping to have plenty of time for questions and discussion at the end. Okay. Looks like I'm having trouble controlling my slides. A minute, please. There we go. Apologies. So starting with the trend data, so we looked at a number of childhood health harms, and I'll walk through just some of the highlights here. Overall, we found that a range of diseases and disorders are on the rise, and that some have risen quite dramatically in the past 30 years. To be very clear from the start, we're not saying that pesticides are solely responsible for these health harms. Many factors are at play, and in many cases there seems to be a combination of genetic and environmental factors involved. So the diseases and disorders highlighted in this figure are just some of the childhood health harms that we found to be on the rise. We relied mostly on CDC data, and I think the image is fairly clear. I won't walk through it in detail. Just to note that the childhood cancer figures here are incidence data, and all the other trend data is tracking prevalence. And I won't be talking in today's presentation about the emerging science linking pesticides with diabetes and obesity, but we do present information in the report on several recent studies on that link. Other health effects that we reviewed that are not included in this figure were birth defects, early puberty, and asthma, all of which are also on the rise. So to walk through just a few highlights from the trend data, in terms of developmental disabilities, public health experts tell us we have a silent pandemic of learning disabilities and disorders. There's been a 17% increase in the number of children diagnosed with some type of developmental disability in just the past 15 years. In terms of cancer, leukemia and brain tumors are now the most common types of childhood cancers, and overall more than 10,000 children are diagnosed with cancer every year. And asthma, the number's also up dramatically from 1980, from 2 to 7 million affected. And I won't be talking specifically today about the science around this health outcome, asthma, but there is some compelling emerging science pointing to pesticides as a contributor to childhood asthma. Okay, I pulled out just a handful of figures from the report on the trend data. The ADHD numbers, clearly from the figures, boys are much more likely to be affected. One interesting thing to note that emerged when we looked at this data, the American Psychological Association reports that girls can be more often affected by just the attention deficit part of the disorder, and that this often goes undiagnosed. In terms of autism, clearly dramatic increases in the last 15 years or so. According to CDC, in the states they evaluated, they found 1 in 88 children were on the autism spectrum, with the likelihood especially high among boys, where it's 1 in 54. So autism rates have clearly increased dramatically, up more than 250% for boys and over 375% for girls since 1997. Clearly the level for girls is much lower, but the rate of increase is higher. Changes in diagnosis in recent years are clearly a piece of the picture, but this really can't explain this dramatic rise. In addition to the scientific research that's been coming out, there's been quite a lot of public discussion and debate around autism, and it's becoming increasingly clear that there are many variables at play, and again, it looks like a combination of genetic and environmental factors. Just very briefly, in terms of cancer, since 1975, an increase in cancer incidence. And again, there's great variation in the rates of increase of various types of cancer, with leukemia up by 40%, childhood brain tumors up by 50% during this time period. Okay, so I want to turn now to our review of the scientific studies exploring the link between pesticide exposure and these various health outcomes. And basically the overall finding is that there's a growing body of scientific evidence that's pointing to pesticide exposure as a significant contributor to childhood health harms. We found that evidence of harm to the brain and nervous system was especially compelling, as well as links to certain childhood cancers. There's a tremendous amount of good science coming out right now, and we found it, honestly, a bit of a moving target as we're doing the analysis. And just since we released the report earlier last month, there have been several additional studies released, or there were some that released that came out just as we were finalizing, and we weren't able to include them in our report. So there's a lot of great work going on exploring these linkages. In terms of cancer, I'm not going to look specifically at highlight the evidence that we looked at, but I want to mention here that there are many studies linking exposure to herbicides and household insecticides during pregnancy to a significantly increased risk of childhood leukemia and brain cancer. And children who live in intensively agricultural areas are also found to be more likely to have childhood cancers, according to a 2008 study here in the U.S., as well as a similar study in Norway. Okay, so I want to focus in on some of the neurodevelopmental effects where there is particularly strong evidence, and I'm going to describe very briefly a handful of the studies for some of these health outcomes. So in terms of autism, we found several studies linking prenatal pesticide exposure with increased risk of autism. Just a couple of examples. One study here in California's Central Valley found that when pregnant women were exposed to the organochlorine pesticides, endosulfan and dicafol, autism risk increased. Specifically, children whose mothers lived within 500 feet of sprayed fields were 6 times more likely to be on the autism spectrum. Organophosphate exposure during pregnancy has also been linked in several studies to pervasive developmental disorders, which can include or be an indicator of autism. In terms of ADHD, UC Berkeley researchers have found that for each 10-fold increase in organophosphate metabolite concentration during pregnancy, they found a 5-fold increased risk of ADHD diagnosis by age 5. Researchers at the University of Montreal and Harvard University report that children who had higher levels of pesticide breakdown products in their urine, and these were levels commonly found in children from exposure to residues on fruits and vegetables, are more likely to be diagnosed with ADHD. And there have also been a number of animal studies pointing to a link between some pyrethroid pesticides, which are commonly used in the home, with elevation of the dopamine transporter, a marker that has been linked to ADHD as well. On this next slide, we wanted to highlight an especially interesting study that came out earlier this year. This is out of Columbia University, where using MRI technology, Dr. Virginia Rao and her colleagues found changes in the brain architecture of infants who had been exposed to the insecticide chlorpyrifos in the womb. And then finally, in terms of cognitive impairment, there have been a number of recent studies. In 2011, there were 3 cohort studies released that documenting the linkage between cognitive impairment and exposure to organophosphates in the womb. The first study found that higher metabolite levels in mother's urine late in pregnancy increased the likelihood of reduced cognitive development in children. The second study linked prenatal exposure to a 7-point reduction in IQ by age 7. And the third study found that even very low levels of chlorpyrifos residues in cord blood were linked to lower IQ and reduced working memory. A couple of other examples that I wanted to highlight here. Children exposed to the pyrethroid pesticide strategist, which is called piperonal butoxide, were scored 3.9 points lower on the Bailey Mental Developmental Index. And there have been a number of animal studies that suggest that exposure to other OP pesticides, diazepam and parathion, during early childhood may also reduce cognitive function. So I wanted to shift now to exposure pathways and the vulnerability of the unique vulnerability of children to pesticide exposure. Many of the studies we looked at focused on prenatal exposure. In addition, early childhood exposure has also been found to be important. And as highlighted in the American Academy of Pediatrics study that came out just a couple of weeks ago, as well as the UC Davis study out just last week, there are many studies now indicating that diet is the primary route of pesticide exposure for children. So dietary exposure is especially important. And of course, young children's behavior, the hand-to-mouth behavior, playing on the floor, etc., means that exposure in indoor and play environments is especially important for young children. It's also true that children's developing bodies are especially vulnerable to exposures to pesticides. And basically, that as bodies are growing quickly, they're taking in more of everything. So that relative to their size, they're eating, they're breathing, they're drinking much more than adults do. An infant takes in about 15 times more water than an adult per pound of body weight, and up to age 12, a child is inhaling roughly twice as much air every day. And then science is increasingly showing that children are particularly vulnerable in their first 7 years because their various mechanisms to protect the body from toxicants are not yet fully developed. And just very briefly to highlight the importance of timing of exposure and the fact that very low levels of exposure can make a critical difference. So I want to shift now to what can we do about it? How do we guarantee a solid start for our children? There are more than 1 billion pounds of pesticides used every year in the U.S. And so our contention is this problem is just too big to solve at the household level. We need some policy changes. And we lay out a big picture goal of reducing that number, that 1 billion pounds of pesticides is too much, and that we need to really start shifting toward controlling pests without relying on chemicals that are known to harm children's health. And we think change is most urgently needed in the way decisions are made about these 3 questions. First, which pesticides are used in agriculture? Second, which pesticides are used in places children live, learn, and play? And third, how are farmers supported as they reduce their reliance on pesticides? So in the report, we highlight some specific areas where we think policy changes are especially important in those decision-making arenas, and I want to highlight just a few of those here. So the bottom line is that we don't think policymakers currently have the tools they need to do the job, that EPA needs to be able to respond more quickly to credible and independent science as it emerges. So implementing the first 2 recommendations on this slide begins to address, move us toward that goal of reducing overall pesticide use, which begins to address the problem of children's exposure through food residues, which as we have seen is one of the key routes of exposure, as well as exposure of adults of childbearing age, so which goes to the problem of prenatal exposure. And I didn't talk about it earlier, but for many of the health effects, neurodevelopmental as well as birth defects, exposure of both the mother and the father factor into increased risk for the child. So on this slide, I wanted to just highlight this policy recommendation goes to the question of rural children who are particularly at risk from pesticide exposure. Farm children, both from farm families and from farm worker families, often face double or even triple risk of exposure, because in addition to the food residue exposure, they may be exposed from drift into their schools and homes, contamination of their water supply, plus residues being brought into the home on clothing of family members who've been working in the field. So in the report, we highlight several case studies of policies that have been put in place by communities around the country. In this case, we focus in on several communities in California, Central Valley, where buffer zones now limit the spraying of restricted use pesticides around schools and near neighborhoods. And finally, focusing on support for farmers. We recommend that as a first step, policymakers corral the existing resources to help farmers shift to safer alternatives. There are EPA programs, there are a number of USDA programs, and we think that coordinating and strengthening these existing programs could help tremendously and would be a really important first step. If we want to move forward to reducing overall pesticide use, as a country, we'll need to ratchet up our support for farmer innovation, and this means pressing Congress to invest additional resources. It basically needs to be a national priority. Just wanted to highlight that the way that we're using this report to start and to strengthen conversations with our partners around the country, with public health experts, with policymakers. We're encouraging our partner groups and our network of individual supporters to use the information we've pulled together to kind of kickstart a national conversation about children's health and pesticides. And we're also ramping up our efforts at PAN to learn from communities who are moving forward with policies that work at the local and state level, and helping to tell these stories more widely, and also connect groups and communities in different parts of the country who share the common goal of protecting children's health. And then finally, I wanted to just highlight a handful of online resources. The report itself is available on our Healthy Kids campaign page. We also have our What's on My Food website, which is a searchable database presenting USDA food residue data combined with toxicological data for pesticide residues. We have our Ground Truth blog, which presents news as well as analysis related to pesticides in children and policy issues. And then Pesticide Info, which presents data on the toxicology and regulatory status of more than 5,000 active ingredients and more than 17,000 pesticide products. So I think I will stop there, and thank you very much for the opportunity to share, and look forward to the discussion. David, handing back to you.
Thank you, Kristin. The next presenter is Dr. Bruce Lanphear, who is a physician and a research scientist at the Simon Fraser University in British Columbia. And now, Bruce, the control of your slides should be transferred to you.
Okay, thank you, David. I don't have any slides, but as I was describing, I'm going to just really provide sort of a perspective on the report, and I was providing a context for my experience as a public health physician and researcher. And so I used to think that once the science was available, that others, policymakers, would pick that up and take it and make sure that the children were protected, that policies were enacted. And again, unfortunately, I no longer hold that view. One of the other things that I've learned over the past 10 or so years is that parents and the public oftentimes hold a very different perspective on risk for pesticides and other kinds of environmental influences. And oftentimes we dismiss those risks because they don't quite understand. Well, I don't think that's the case. I think there is oftentimes a difference in the perception of risk, but I don't think that that is an indication of parents being uneducated or undereducated. Rather, I think it's that they have a different way of dealing with that risk. And I think when people understand, when data like what's available in this new report by the Pesticide Action Network is available, people become quite uncomfortable and they want to do something about it. And so from that perspective, I think this report is very important. It's trying to take science that oftentimes is not very accessible to the public, to parents, and make that available. This is always a challenge, this balance between taking science and reporting it accurately and simply, because if it's not simple to understand, many people won't be able to access it. And we can, of course, make things as complex and confusing as we want with acronyms and chemical names and so on. And so this report overall has just done an outstanding job trying to take the science, the policy, and make it accessible to people. Now, we could quibble about a few things. For example, in the report they talk about the fact that ADHD is on the rise. And in fact, there is some evidence to suggest that might be. But the evidence is suggestive at best, because we're relying right now on clinical reports or visits as opposed to, let's say, a nationally representative sample where we have diagnostic criteria and changes in the prevalence over time. So those are the kind of things we need to be thoughtful about. But having said that, a brain disorder like ADHD, which is the most common brain disorder in children and affects 10% of kids, is almost by any definition epidemic. And of course there has been dramatic increases in autism, in asthma, and some of these other new morbidities. So there's really two different ways of thinking about these new morbidities. One is that they've always been there, sort of lying in wait, but they weren't apparent because we were more concerned about tuberculosis or polio or measles. In fact, there's quite a bit of evidence now that the rise in these new morbidities has quite a bit to do with exposures to environmental toxicants. Now, there are other players, of course, but there's quite a bit of evidence, as Kristin has described, in particular for pesticides. And so what that really should push us to do is to begin shift our focus from treatment of these diseases to prevention. But that's where we haven't been able to take action. We've gotten caught up in the definition of causality. And as epidemiologists, that's understandable. Oftentimes our policymakers are in a straitjacket because of particular mandates. And so what I've ultimately come to the conclusion, and why I think this particular report is important, is that it is critical for the public to understand what we know about the toxicity or suspected toxicity of environmental toxins like pesticides. Because what we have found out over the past 3 to 4 decades is that a whole host of low-level environmental chemicals, metals, in some cases established toxicants, are associated with fairly significant disease and disability in children. So we do know that now. We're also finding, as Kristin pointed out, that some of these occur at the lowest levels of exposures. For lead and particulate matter and tobacco and benzene, in fact, we're finding that for given exposures, the decrements in IQ or the increase in risk of premature death from heart disease or birth weight are steepest at the lowest levels of exposures. That is, these new studies are beginning to suggest that there may not be any safe level of exposure. So, as described in this report, there is mounting evidence that pesticides are risk factors for a variety of conditions in children: childhood cancers, IQ deficits, ADHD. There's studies that show and systematic reviews that confirm that pesticides that are used in and around the home are risk factors for childhood cancers. There are 3 studies that have found consistent and compelling evidence that that organophosphate pesticide exposures are associated with IQ deficits and an increase in rates of ADHD or ADHD-like behaviors. One of the things that I find especially interesting, perhaps troubling as well, is that, like with pesticides, there's a whole host of other environmental toxicants: lead, mercury, PCBs, perhaps airborne pollutants that are also associated with the development of ADHD. Now, oftentimes, historically anyway, we thought about one agent, one disease. How could this be? Well, one of the things they talk about in this report I find particularly intriguing is this notion of a common pathway. That is, many different exposures to toxicants, for example, can get you to the same place, like a condition of ADHD. How could that be? Well, ADHD is really a medley of maladaptive behaviors. It's a cluster of symptoms. It may be that lead exposure is associated with more aggressive behavior, which is one of the symptoms that makes up ADHD. It could be that hypothetically, OP pesticides are associated with hyperactivity, which is another part of the ADHD cluster. Different toxicants and other environmental influences each can increase certain behaviors, but the ultimate consequence is to increase the prevalence of ADHD in a population of kids. The other thing that makes ADHD particularly troubling or concerning is that ADHD, as well as antisocial behaviors, criminal behaviors, impact the prefrontal cortex, that part of the brain that makes us most distinctly human. And when we start messing with that part of the brain that makes us human, we have to be very cautious. So what should we do? Well, first of all, by the time there's enough evidence, the question always arises, well, but what about the cost? We do know from some cost-benefit analyses and some economic analyses that are out there that the cost of these toxicants, including OP pesticides, is really quite large. Overall, it's been estimated that the cost of exposures to environmental chemicals leads to costs somewhere north of $50 billion a year. One of the things that's most troubling to me is that the profits for a lot of these products that we're talking about, pesticides, for example, the profits are privatized, but the cost to do the research, the cost to families of a child experiencing cancer or ADHD, the cost to remediate or remove the toxins from the environment are all borne by society. So what are the questions? What are the looming questions we have to deal with? Well, obviously one of them is the evidence sufficient to take action? Is it definitive? In science, very little is definitive, but I certainly have arrived at the conclusion that we have sufficient evidence. We know enough to take action. And I think Kristin laid out a number of things, and I'll just reiterate some and perhaps add a few others. I think the first point is that we have approached each new chemical as though we've never met a toxin before or a toxicant before. It seems to me very unscientific to recognize that lead, low-level exposures to lead and mercury and DDT can be associated with these diseases and disorders in human population, but that the next chemical that we're studying may not be. I think the first thing we need to do is begin to shift the way we determine whether a chemical may be toxic, that is to do it before it's marketed. The European Union has moved towards this. There's been some energy devoted to this, but it hasn't gone very far in Congress because largely of vested interests. But we need to begin to require industry to prove that their products aren't toxic before they're marketed. That's probably the most important because, as Kristin noted, we can't expect parents to be chemists. We can't expect parents to know about all these different chemicals that are in food products or products they use in and around the home. I do this for a living, and I can't know. There's too many of them, and most of them don't have sufficient evidence to make those kind of determinations. So one thing we can do is to work towards revising TSCA and other regulations about industrial pollutants and pesticides. Number two, I think whenever feasible, when parents can afford to, I would recommend that they choose organic food. Now, it's not always feasible. In that case, one can try to eat foods that tend to contain less pesticides, and there are websites you can look at for that. But I think we are at that point, and as Kristin pointed out, there are a number of ways we could try to increase the accessibility, to encourage innovation in providing organic food as opposed to the monoculture, chemistry driven agriculture or industrial agriculture. In Canada, 5 of our provinces have banned the use of cosmetic pesticides in and around the home. Basically, they said this is low-hanging fruit. These are unnecessary. There are other alternatives that can be used. We don't need this kind of risk for our children. We need to question many of the assumptions that have been put out there and by and large accepted by most of us. Can we feed the world without industrial agriculture? There's some evidence that would suggest we can. And it's clear that even with pesticide-driven agriculture, we're not feeding the world now. So I think we need to take some of those assumptions and begin to question them, to begin to be more skeptical. And then finally, making sure that people are aware and know when pesticides are being used. So overall, just as conclusion, to point out that I thought this report has done a tremendous job of trying to take a large body of science, of evidence, of policy, and make it accessible, and by and large did us all a tremendous service. So thank you.
Great. Thank you, Dr. Lanphear. And thank you, Kristin, as well. We've got about 20 minutes for questions, and a number of great questions have come in. I'm going to order them a little bit. First of all, I wanted to mention that many of the slides from Kristin Schafer's presentation were directly out of the Pesticide Action Network report. You should be able to find that on their website, panna.org, P-A-N-N-A.org. You know, as presenters, as is typical, we have kind of a range of questions going from what individuals can do or how they ought to think about the findings of the report and of the new science impacting on their own decisions, going all the way up to sort of policy level questions. So why don't we start with the former first? And one question is, okay, say you already, I mean, we said that exposure to pesticides for each of us individually is pretty widespread. So after the fact, is there something we can do about it to ameliorate possible impacts?
I can take a first stab at that as Kristin, and then if Bruce has something to add, that would be great. One of the studies that we looked at that came out several years ago out of University of Washington, I believe it was, showed for children that if they switched to an organic diet for a period of about 10 days, the level of metabolites in their blood dropped dramatically, which shows, you know, that many of these pesticides do work through the body fairly quickly. There are organochlorine pesticides, some of the longer-lasting pesticides that accumulate in our body and are more difficult to clear. But many of the organophosphates and other insecticides that are used, it's the constant exposure that keeps the level up. So that if you reduce your exposure, you can actually, that's one of the main things you can do to then clear your body of the toxins that you've been exposed to. Bruce, if you wanted to add anything to that.
Yeah, I mean, those are great points. I took it a little differently, so let me try a different tact and see if that helps to answer the question. And one of us maybe have gotten it right. So let's say a child was exposed to pesticides that either increase the risk of ADHD, for example, or certain behaviors associated with ADHD. Are those amenable to treatment? As far as we know, the evidence would suggest from other toxicants like lead, like tobacco, that if we're talking about prenatal exposures, we can imagine that those will be permanent. They will persist. There's certainly a number of things that we can do, whether it's cognitive therapy, better structure in our environment to try to minimize those, but I think we should assume, in the absence of data where we followed kids out, we should assume that some of these types of behaviors will persist. For other kinds of conditions like cancer, of course, yes, there is treatment, and in fact treatment has become relatively effective, very effective over the past 3 to 4 decades, but there are also long-term consequences of that chemotherapy, which of course is itself a toxin. So I think the main thing is, given what's coming out with all of this, we need to shift our efforts towards prevention, and where we've failed, where children fall through the cracks, we can rely on treatment.
Great. In the same vein, like if you want to think about your home environment and you want to take steps to reduce your exposure to pesticides, are there certain kinds of products that you ought to be targeting, and then a related question has to do with agricultural areas. If you're talking about pesticide drift, how do you know that you're in an area where there's drift occurring?
So I can take a first crack at both of those. In terms of products to be targeting and kind of alternatives that you can use in the home, first let me go to alternatives. There's a section on our website that has some pretty concrete hands-on, suggestions for how to control various pests in the home and garden, etc. The interesting thing about the question of shifting to other products, if you're talking about other pesticide products, what we often see is this pattern of new and improved and supposedly safer products we find actually do have health effects that weren't recognized initially, and I'm thinking of pyrethroids, which are very widely used for home pest control, and in recent years, evidence has been mounting that there are unexpected health effects from pyrethroid exposure. So often it's really shifting to a different kind of preventative pest management, using chemicals if you need to as a very last resort can reduce exposure levels pretty dramatically. And there might be other examples from the Canadian experience where pesticides really are not used at all in several provinces for home and garden pest control. Clearly it's working, and there must be some good examples there. Just really briefly in terms of drift, one of the interesting things about pesticide exposure is that for many pesticides it is kind of an invisible exposure, that it's it can be odorless, you can't see it, and so on. So basically in California we're lucky we have pesticide use reporting, so folks in agricultural areas can get information from the agricultural commissioner and sometimes get information before pesticides are sprayed. In some areas, it's just a matter of being observant. PAN has developed a tool called a drift catcher that we've used with communities around the country that is basically catches drift in the air in a canister over a 24-hour period that gets analyzed by independent labs and can detect what pesticides at what concentrations are found in and around schools or homes. And that then gives the families and communities, the information they need to, if they then want to push for any policy changes, work with local farmers, have the conversation about how can we reduce these pesticide exposures, they have the data to start with. So those are some ideas to answer those questions.
Great, thank you. Bruce, do you have anything to add?
No, thank you.
Okay, let me direct a question specifically to you, Bruce. And you talked about low-level exposure. Can you kind of put that in context? Are you talking about pesticide residues in our diets, or from home use, or proximity to farmland? How should we think about that?
Well, it starts out with really sort of the broader concept that for a long time we've been told that don't worry about it, these are low-level exposures, and because of that they will be of no consequence. They're in the parts per billion typically. But most of us are regularly exposed to a whole host of pesticides and other toxicants. So when we looked at a population of pregnant women in Cincinnati, which is largely representative sample, 80% had measurable levels of DDT in their blood. 95% had measurable levels of DDE, which is a metabolite of DDT. Over 95% had OP pesticides in the urine. Over 95% had pyrethroids in their urine. 100% had measurable levels of lead and mercury. Virtually all of them had measurable levels of bisphenol A and phthalates. So are these low-level exposures? Well, from an evolutionary perspective, most of them are really extraordinarily high. Are they toxic at these low levels? Well, that's a little hard to say for some of them, but there's a number of new studies coming out with lead, for example, and IQ deficits. We see at the lowest measurable levels that there appears to be the steepest decrement in IQ. It levels off at higher levels. So we've seen now the same thing with benzene and leukemia, with airborne exposures to PM2.5 or airborne particulates, fine airborne particulates, and premature death from heart disease, with tobacco and birth weight. So that we've always thought or believed or accepted this idea that until you had very high exposures, no harm would occur. These studies of some of the most well-studied and established toxicants would suggest something quite different. That if we wanted to protect public health, we should assume there may be effects at the lowest measurable levels. We shouldn't assume that they are safe or innocuous. One other perspective on this. Again, we've been advised by the chemical industry that these levels that we're talking about, let's say 10, 20 parts per billion, are too low to be of any consequence in a pregnant woman or a child. 10 to 20 parts per billion is the same concentration that physicians try to achieve with methylphenidate or risperidol, which are drugs used to treat ADHD and other types of psychotic or psychopathology in children. So at the same time, there's this multi-billion-dollar industry to use chemicals to alter behavior or improve cognitive abilities in children. We're finding that environmental chemicals at similar concentrations can also change behavior, sometimes for the worse. It appears to be most of the times for the worse. So we shouldn't accept this notion that the levels of exposure that our kids have are too low to be of any consequence.
Thanks, Bruce. And I would add that when we rely on birth control pills, I think those also are designed to be effective at part per billion levels in the bloodstream. So that's kind of another analogy. It sounds like, well, let's kind of segue into some of the policy questions, because there's a number of interesting questions that come up. But first, I think about 6 weeks ago, there was a study that got quite a bit of attention coming out of Stanford on whether or not there's benefits to eating an organic diet. So given the conclusions of the PAN study, how do the two things correlate? How should we think about this study in light of the Stanford study or vice versa?
Yeah, the interesting thing about the Stanford study that was not captured very well in the media coverage in many cases is that they were looking primarily at nutritional benefits versus the impact of pesticide residues. So where the headline said there's no benefit to eating organic, most of the articles, when you actually read them, did point to the fact that oh, and by the way, there are pesticide residues and they may be a concern, but that was not the focus of the study. The focus of the study was on whether there's nutritional benefits or not from a switch to organic, and some of our colleagues have also taken issue with those findings, saying that the analysis was really not very careful and that there is actually more evidence than suggested by that study that there may be nutritional benefits from the switch to organic. So that's how basically we're looking at different issues than what the Stanford study focused on.
The other thing that I find intriguing, and this is more speculative, but it seems to me that we're conducting the same kind of experiment we did when we shifted newborns, infants, from breast milk to formula. That is, we evolved with produce grown a certain way, and then it's been changed. What are the implications of that? Well, we haven't really fully understood that. We're just beginning to ask some questions. But one of the things I find particularly intriguing is that one of the differences between organic produce, some organic produce, and conventionally grown, industrial grown produce is that the organic produce has higher levels of salicylic acid, which is aspirin. And we give people over 50 typically, an aspirin every day or every few days to prevent heart disease. Could it be that part of the reason we have to replace aspirin is because we've taken out of our diet? So there are a variety of things that we should be thinking about. One is the toxicity of some of the pesticides and other contaminants in our food stuff. But the other is to recognize that as we evolved over the past thousands of years, we evolved with certain things. We evolved with exposures to certain levels of chemicals in the environment, like lead. And until the Industrial Revolution, we were exposed to very low concentrations. We were exposed to largely organic produce. Now we're changing all of that, and there are likely to be consequences. So I think one of the things that I would harken back to is, since this is the 50th anniversary of Silent Spring, is something that Rachel Carson said, which is pesticides and thalidomide. We rush ahead without knowing what the results will be. And we haven't really learned from the thalidomide epidemic, or the lead epidemic for that matter, because what we have failed to do is to recognize that low-level exposures to toxicants like pesticides, which are designed to be toxic, we know they're toxic, can have adverse consequences. We act as though they don't.
Thanks. So they're thinking about policy, there's a couple questions about either implicitly or explicitly about what are the low-hanging fruit. Like are there, for example, there's a lot of talk right now about school lunches and improving the quality or at least the quantity of fruits and vegetables in school lunches. So is that someplace where we ought to be thinking about the literature on possible impacts of pesticides, or are there other low-hanging fruit in terms of legislative or policy change?
Yeah, the example of school lunches is a really good one, and in the report we do highlight some of the really exciting momentum around farm-to-school programs where that are gaining traction across the country that basically not only support local farmers that provide fresh fruits and vegetables to children in school cafeterias, but many of them are also choosing organic and sourcing organic produce for the kids. And so it's definitely building on that momentum and looking how to provide incentives for school districts to support that kind of program, is something that we did identify in our list of policy recommendations as something that could and should move forward really quickly. In terms of other legislative low-hanging fruit, a lot of, we find that in this policy area, the local and state level, particularly the state level, it's a difficult policy arena, but it's where we may be able to gain some traction and momentum. At the national level, there are also a number of groups who are interested in kind of looking at this, coming at this issue through the lens of protecting children's health and looking at how can we take a look at the national pesticide legislation and see what are the key pieces that could be improved that give EPA those tools that they need to act more quickly, as to follow the science when it comes out. So it's a bit of an uphill battle. In terms of the interests around this issue, there's very well entrenched interests that want to see the status quo continue as it is. But there is we're seeing increasing interest and commitment among our partners to identify those key points of leverage where we might be able to really make a difference.
I think there's a couple of questions too, sort of how do we get there questions. So Dr. Lanphear, I think you talked a little bit about the way that pesticides coming on the market currently are tested. How do we turn the tables to get to the point where things need to be, have things proven to be not toxic before putting them on the market? Yeah. Can you get a little more concrete? Like what would the next step be on that?
Yeah. Yes, and I hope I don't sound too cynical. I think the main thing we need to recognize is that our regulatory agencies won't be able to do it unless there's broad public support. Our public health officials won't be able to do it unless there's broad public health support. One of the things that I learned after having left the United States for Canada a few years ago is that one of the things that has troubled me quite a bit is that increasingly our country is being run by mega corporations. They are the ones making the policy decisions more often than not. Now, what that means is, if you take the analogy further, that each one of us as a U.S. citizen is a minority shareholder. The challenge is we have to compete with majority shareholders like Dow Chemical, for example. So in the end, I think incremental improvements like improving school lunches is a wonderful step, and I think we need to look for those kinds of small successes. At the same time, we shoot for the long-range goal, which is to revise the regulatory framework that will protect us from environmental chemicals. But that's going to take literally bringing together enough of us minority shareholders so that we can overwhelm the majority shareholders, and I'm afraid that's going to probably be 65, 75% or more of us that will ultimately have to step up and say, enough. We want better protection, and that's what, and this will require changing policy.
Keeping that in mind, if somebody is interested in seeing something happen more at the local level, whether it's with a school board or trying to get parks to no longer use pesticides, how would they go about that? Can you repeat some of the resources for people to find each other or to form groups to advocate for policy?
Yeah, I could. On our website, so we have our Healthy Kids campaign page, so PANA.org, and you can go to current campaigns, and there's Healthy Kids, and we have a top 10 ways to protect kids from pesticides checklist, and it offers various levels of engagement, various ways that people can plug in, get involved, and either in their communities or with broader policy fights, or just starting the conversation, with neighbors and folks in their schools, again, to kind of build that public will and momentum that is really needed to move these larger policy issues forward and make progress. So that's one place to plug in, and I think there are resources there that link off to really specific ways that people can get involved at those various levels.
Thanks. We're coming up in the hour, and I want to respect everyone's time. I would just have a few concluding remarks. First of all, thanks so much to our presenters for their time today. And thank all of you for joining us for the Healthy Food, Healthy Farms webinar series. Next week, we will be putting up a broadcast copy of the webinar so that one can listen to it then if for some reason somebody wasn't able to make it today. The next webinar we're co-hosting with Pesticide Action Network is in mid-January, and it will concern community health concerns around atrazine, the corn herbicide that once was the most widely used pesticide in the U.S. and the world. Also, I would say, besides the resources Kristin mentioned, that Healthy Food Action is interested in getting health professionals involved in some of these policy questions. And if you go to healthyfoodaction.org, you'll not only see upcoming webinars, but also particular in the future discrete opportunities to advocate around policies. And you can follow us on Facebook and Twitter as well. So thank you all very much, and thanks to the speakers, and we hope to see you on our next webinar. Thank you very much.
Thank you.
Thank you.